everyone. Welcome to Close Up on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Janice Marie. On each edition of our show, you have the opportunity to meet some of the most innovative business leaders in the country today. You'll find out what their products, services, technologies, and business models can do for you, and what they're doing to change our world and to change the way we do business.
There is an old saying that indicates if you have your health, you have everything that really matters, because without that, life could really be terrible. Which is why it can be so frustrating to suffer from some debilitating problem and going to see doctors who, one after another, are unable to come up with a solution. And that is what makes the story of Dr. Daniel Pompa so amazing. Dr. Pompa is a chiropractor practicing in the Pittsburgh suburb of Wexford, Pennsylvania. He is a chiropractor, but he specializes in treating what are known as neurotoxic illnesses. And he has clients who come to see him from all over the country, because often in a matter of hours or less, he has been able to come up with a solution to the problem that has been plaguing them for years. For many, he has become their medical messiah, and he has actually changed their lives. And it all came about because he suffered from so many seemingly incurable problems himself.
I specialize in structural correction, which is more than just moving one bone at a time. We're looking at the whole segments of the spine and repositioning them, which has an amazing difference in the fact that it affects your autonomic nerve system. So it's not just about pain, because pain only represents 6% of the nerves. 94% of the nerves actually run function. So when you're doing these structural changes, you're really affecting the function of the body. So that's one different aspect. But the other half of my practice, I treat neurotoxic-mediated illness, which is neurotoxic disease, is something that people really probably aren't familiar with the name, but they're familiar with the symptoms. Things like fibromyalgia, chronic fatigue, depression, insomnia, anxiety, hormone imbalance. These are neurotoxic conditions, and they're spreading. This is an epidemic that's really changing America and how we look at health.
What happens when someone comes in here for a first appointment? What's the process you go through with them?
Typically, it really depends on what they're, coming to me for. Some people come to me with a neck pain, and then we're taking x-rays and we're doing things to figure out, okay, what's going on, because there probably or maybe a structural problem. But if a neurotoxic patient comes into me with, say, I can't sleep, I have insomnia, or, I'm on, these medications, I'm depressed, it's not working, then we're going to take a deep history. We're going to figure out when they felt good and what happened. What happened at the time when you started feeling sick? And then I start asking questions. It's really, you're trying to find the needle in the haystack. And typically, you find either a physical trauma or an emotional trauma that occurred during that time. That's why it's one of my pieces of my puzzle of really helping people, because they did something that triggered their immune system, that God-given ability to heal itself, to not work anymore, meaning that their body's not finding balance anymore. They become out of balance, and now a disease process starts.
When I was about 17, I started to get some bizarre symptoms. I started to get sick. I had severe gastrointestinal issues that would actually cause me to miss chunks of time during the day at school and just lay in the nursing's office and be very, very sick. And that was the first of many symptoms, because I'd been very healthy, I was very athletic, and nothing had bothered me yet. And so they diagnosed me with irritable bowel syndrome and tried different medications on me, and also thought that maybe it was something psychological as well. And so they tried to put me on Zoloft. And in the meantime, I started to gain weight unexplainably. I'd basically gained 40 pounds in 2 years. So I was just depressed because I was in this body. I was on 6 medications, and I was basically feeling like I was getting sicker and sicker on these medications. And I was so young, and I felt like these are the years where I need to be young and healthy. And so a friend of mine recommended Dr. Pompa to me because she knew of all my health issues. I was very skeptical. I didn't want to tell another doctor my story. I didn't want to be put on any more medication. I didn't think anyone would understand. But she got me to come here anyway, listen to one of his talks on toxicity, and he described every symptom I had and packaged it into this toxicity label. And I said, I don't know what toxins are. It kind of sounds scary to me, but I definitely have toxicity. So I was able to lose weight for the first time in years. I was able to lose 18 pounds. I feel free. I don't suffer from depression or mood anymore. I'm high energy. I used to suffer from fatigue. I'd be tired all the time. I'm a different person, and I don't get any cravings for food. All I can say is I'm completely different than I was a year ago, and I thank God that I found Dr. Pompa.
Marilee, what was it like for you when your husband got so sick?
It was unbelievable, actually. It was really hard for me to accept that he was sick or that he was getting sick. At the time, I didn't realize that he wasn't as sick as he was actually going to get. He had fatigue, he had debilitating headaches, he wasn't sleeping at night, he couldn't tolerate just normal noises of life and of family. And it was so sad because he was always so healthy. He was never sick. We were known for the way we lived our lives and what we did to be healthy. We did things that nobody else would even consider doing, and we just did it naturally because we were changed by the knowledge that we had.
What happened?
Well, first of all, I wasn't willing to accept that he couldn't figure it out. My husband is brilliant, and I've always known that, and I've just always recognized his gifts. And then whenever all this began unfolding, I realized that this was the vehicle that God was going to use to give him the knowledge, the understanding, the compassion, and everything else that he needed to add to him to make him as effective as he could be. And so I just hung on to that, and I kept reminding him, of course, that you are going to be okay. God has his hand in our life. He has not called you to the profession that he has called you to after you were out doing your thing if it wasn't for the fact that he has an incredible purpose and a plan for our life. Because at the other side, we were going to be very effective, not just in our life and our testimony, but in the opportunity that he was going to have to impact so many people.
To understand the puzzle, you have to really understand, again, my story and what I went through, because I was one of these patients that I now treat. And really through the evolution and, of myself getting well is how that puzzle came together. And it's really looking at somebody as a whole and saying, okay, there's really four main pieces of these really sick individual puzzles. The diet is one of those pieces. We understand that if there's something that we have to remove to get these patients well, these neurotoxins, whether it's a biotoxin, again, a biotoxin is simply a toxin that attacks your nerve system. It comes from a living thing. So under that category, you see mold and Lyme. And then in heavy metals, you have things like mercury, lead, arsenic, but all of those things are neurotoxins. It seems in these unexplainable illnesses that it's these neurotoxins that attack your brain and basically every nerve in your body. This is what really makes people very sick. And right now, we have an epidemic of neurotoxic illness in this country. And then the physical nerve stress, or the nerve stress, is a piece of the puzzle, because a lot of these people, and there was a study done in 2005 that showed that when people get in an auto accident or a trauma, it can kick in fibromyalgia. And again, fibromyalgia is just a name for a classic set of symptoms with fatigue and just unanswerable symptoms that nobody can explain. So we know that nerve stress all of a sudden allow these toxins to become a problem. So you could have had, Doug, the toxins in you for many times and your body was dealing with it. Your immune system's dealing with it and clearing it. And all of a sudden you have a trauma, and now all of a sudden these toxins, your body's not dealing with it. So now you're not finding balance, and now you get sick. So that's really the puzzle, and I think that's what we're doing that is so unique, is we really have put these together. Many doctors are treating heavy metals, but they're ignoring the fact of nerve stress that needs to be dealt with. And that's where a lot of my structural correction work comes in. A lot of doctors are dealing with biotoxins, but they're not addressing the heavy metals. So they're not going to get people well to the next degree. A lot of doctors are dealing just in the diet and not realizing there's a major neurotoxin that needs removed. So really that's the idea of the puzzle, is we're putting it all together. And when you treat someone with those four pieces of the puzzle, this is how we're getting people well.